Hello guys, good afternoon, and this is Professor Henderson. Thank you again for tuning into my YouTube channel. If you're new here, please consider smash the subscribe button and like and share this video. So today I'm coming to you about another simple video on the advanced cardiac life support test review questions. So again, if you like these types of videos and these types of educational material, please smash that subscribe button and please subscribe to my channel. I would really appreciate that to help this channel out. I want to extend my greatest gratitude for those who have been subscribing to my YouTube channel. Thank you so much. So let's dive into the video. So the first question I have here: a nurse finds an unresponsive patient who is not breathing. After activating the emergency system, you determine that there is no pulse. What is the next priority action? Open the airway with head tilt chin lift. Administer epinephrine at a dose of 1 milligrams per kil. Deliver 2 rescue breaths, each over 1 second. Start chest compression at a rate of 100 per minute. So what do you think is the correct answer for this question? So the correct answer for this question is C. Deliver 2 rescue breaths each over 1 second. We don't want to open the airway with head tilt chin lift because we don't know if the patient had head trauma. If they had any type of surgical injury, you can cause further damage if you kind of tilt their head back. So we need further clinicals to rule out that they didn't have any surgical injuries before you do the head tilt chin lift. So the correct answer is C. The second question I have here is that you are evaluating a 59-year-old female with chest pain. The blood pressure is 94/50 millimeters of mercury. The heart rate is 92 breaths per minute, non-labor, respiratory rate of 12 breaths per minute, and the pulse oximetry is 97. What is the next critical assessment? So the next assessment, as you can see, the blood pressure is slightly on the low side, slightly hypotensive. The heart rate is within normal limits because the normal heart rate is 60 to 100 beats per minute, and as we know, the SA node, the sinotral node, is the electrical component of the heart that fires 60 to 100 beats per minute. So that's the pacemaker of the heart, the SA node. So the respiration is on the low side because the normal respiratory rate is 16 to 20. This is slightly low. The pulse oximetry is within normal limits. So the correct answer for this question is A. Let's look at question number 3. What is the preferred method of access for epinephrine administration during cardiac arrest in most patients? Answer A, intraosseous, B, endotracheal, C, central intravenous, D, peripheral intravenous. So the correct answer is D, peripheral intravenous. So it's important that you establish a line so you can give medications through the line as soon as possible. So D is the correct answer. So this question states an activated AED does not properly analyze the rhythm. What is your next action? Begin chest compressions. B, discontinue the resuscitation attempt. Check all AED connections and reanalyzed. rotate the AED electrodes to an alternation position. So the correct answer is to check all AED connections, because sometimes if these connections are loose, it can really prevent the AED, the automatic external defibrillator, from analyzing the cardiac rhythm. So you would want to check all the electrodes, make sure they are plugged in snugly. So C is the correct answer for this question. Let's look at the other questions. We have another question here. What is a common but sometimes fatal mistake in cardiac arrest management? A, failure to obtain vascular access. B, prolonged periods of no ventilations. C, failure to perform endotracheal intubation. D, prolonged interruption in chest compression. So the correct answer to this question is C, failure to perform endotracheal intubation. So we know when a patient's in cardiac arrest, we have to establish airway patency, because we don't want them to aspirate on the secretion. So we have to put in an ET tube right away. So that way we can suction the patient through the ET tube. We can give epinephrine through the ET tube. We can give a lot of medication through the ET tube. So the correct answer is C. Let's look at the other question. This question states, let's see. Which actions is a component of high quality chest compressions? So we have allowing complete chest recoil. B, chest compressions without ventilation. 60 to 100 compressions per minute with 15:2 ratio. Uninterrupted compression at a depth of 11 to 4. So the correct answer to this question is chest compressions without ventilation. That's the correct answer, B. Let's look at another question, see what's the other question is about. All right, this is another simple question we have here. Which action increases chance of successful conversion of ventricular fibrillation? A, pausing chest compressions immediately after defibrillation attempt. Administer 4 ventilations before defibrillation. Using manual defibrillator paddles with light pressure against the chest. D, providing high quality compressions before defibrillation